So radiation is very, very useful for diagnosing diseases in medicine. Most of these diagnostic techniques involve a radio tracer. So they take a compound such as glucose or an antibody, and they will add a radioactive nuclide to it. And this enables that compound then to be tracked in your body. So it allows you to trace it using radiation. So you can track the movement. So these are really useful because they can be detected with great sensitivity. Because they're giving off this radiation, it's easy to detect them, and you don't need a lot of the radio tracer to be able to detect it. Also, these tracers are going to act identically in chemical behavior to the non-radioactive. If you put a carbon-14 atom into a glucose molecule, that is not going to affect how the body reacts with the glucose. It's just a different isotope of the same element, and the chemical reactions are all identical. So an example is to assess your thyroid gland, and interestingly, my husband had this done recently. So they can give you iodine-131, which is radioactive, and your thyroid naturally concentrates iodine. So they give you iodine-131, and that gets concentrated in your thyroid gland, and then they can get a really nice image of your thyroid gland. They can also look at the rate of iodine uptake, so they can measure the functioning, and they can image your thyroid gland without surgery. So completely non-invasive. So different elements are taken up preferentially by different organs and different tissues, and so there's a lot of different radio tracers that are used. And here's some examples. Technetium-99M is used for looking at various organs and bones. Iodine-131 for the thyroid. Iron-59 in your blood, looking at blood and spleen. Thallium for the heart. Fluorine-18 is used for PET studies, positron emission tomography studies of your heart and brain. And phosphorus-32 can be used for looking at tumors in various organs. You look at the half-lives of these isotopes, and they're either, hours or days. So this is not like millions of years. So it's like they're not giving you something and you're going to be radioactive forever. It's a very small dose, and it will dissipate within, like that. The days one is probably going to take a couple months. But any questions? So here's an actual image using antibodies tagged with technetium-99M. So this is a bone scan created by gamma emission of TC99M. Cancerous tumors naturally will concentrate phosphorus. And so if you give the patient phosphorus-32 or a phosphate compound that contains TC99M, then you can see where that is concentrated and you can identify where possible tumors are. Really, really useful in diagnosis. You may have heard of a PET scan, positron emission tomography. So this uses positron emitting nuclides. They're attached, like F18, it's going to be attached to a metabolically active substance like glucose, which will be taken up by the heart and the brain. And then as that F-18 decays, we can, the emitted positrons will combine with nearby electrons, because positrons are the antiparticle of an electron. And when those two antiparticles annihilate each other, they produce two gamma rays. And those gamma rays go in exactly opposite directions. So you've got positron and electron annihilate each other, and they go in opposite directions. Because of that, we can tell by scanning all around where they came from. So very, very cool. Array of detectors can find the point of origin, and so we can get highly detailed images showing the rate of glucose metabolism and various structural features in, say, the brain. Very, very cool stuff. So radiation is used in diagnosis. It is also used in therapy or treatment. Radiation is very effective at killing rapidly dividing cells. What do cancer cells do? They reproduce rapidly, right? So radiation is useful for treating cancer. So gamma rays are typically used for this. The gamma rays are focused on internal tumors, and the beam is rotated, moved around, but always hitting the tumor, because you're going to get some damage to the healthy tissue that the beam is going through. But if you're doing this from all directions and all of those beams hit the tumor, you're getting just a little bit of damage to the healthy tissue and a lot of damage to the tumor. And so this can be used to take care of tumors in the brain that cannot be operated on. You can't do surgery because the process of doing surgery is going to do more damage, right? You can't just cut through somebody's brain willy-nilly. There are places that, brain surgery can be done and tumors removed, but other places they cannot. And so this, I believe it's called the gamma knife technique, is really useful for that. So, like with anything, you have to consider a risk analysis. Do the benefits outweigh the risks of the procedure? So a therapeutic dose of 100 rems is going to increase your cancer risk by about 1%. So that's not great. You don't want to increase your cancer risk. But without the treatment, if you have a 100% chance of dying, now a 1% chance of increased cancer sounds like a pretty good deal, right? So sometimes the treatment for cancer can cause more cancer. But in the meantime, it has kept the person alive. And so literally everything in life, there's a risk and a benefit, right? You get up in the morning and you leave your house. There's a risk, right? But there's benefit also. Your life is not going to be very great if you never leave your house. And the thing is, my boys played football in high school, and other moms said, how can you let them? Aren't you worried they're going to get killed or whatever? And I'm like, well, there's risks in everything, right? You can die of a brain aneurysm in your bed while you're sleeping, right? There's no way to know. There's no way to prevent it. It's going to happen. You could be crossing the street in the crosswalk when you have the right of way, and a car could hit you, like happened to my son, right? You're doing everything right. He was not killed. He got a really bad concussion and stuff, but he's fine now. But you can get run over by a bus through no fault of your own, right? An airplane could crash into your house. We don't think about the risks of these things, right? But then we're like, ooh, radiation exposure. Well, actually, we're all being exposed to radiation all the time, right? And so everything we do has risk. And this is one of the things that came up with, COVID-19. It's like, well, yes, there's risks maybe in the vaccine, but there's also very big risks in actually getting COVID-19, especially if you have extra health concerns. And so nothing is completely safe, So that's really disturbing, right? But we have just become accustomed to most of those risks, right? Do you ever think about the risk that you incur getting in your car and driving to work or to school? That's one of the riskiest things you can do. People get killed in car accidents all the time, right? Do we think about that? No, we don't really think about it because we've accepted that as part of normal, right? But then, people say, well, this plane has, this percentage of, you've got this chance of crashing, and some people are like, Well, you're actually much safer in an airplane, right, than you are in a car driving to the grocery store, right? So it's all relative risk and what we've become comfortable with. Does anybody have any questions? Come on. Oh, there's one more slide here. There are many other applications of radiation. Radioactivity is really great at killing microorganisms, right? And so it can be used to sterilize medical devices. Somebody needs a pacemaker. Well, you're going to implant that in the person's body. We need to make sure there are no microorganisms, germs, anything on that. Well, you can't sterilize that necessarily like in an autoclave with high heat and steam because you're going to damage the device. But you can irradiate the medical device and kill anything that's living in it without damaging the device. Does that make the device radioactive? No, it doesn't. Radioactivity is also great at killing bacteria and parasites in food. E. coli, salmonella in raw meat and poultry. I mean, we hear all the time about, this thing's been recalled because a bunch of people got salmonella poisoning. Or so many people died of E. coli because of this contaminated hamburger. That could all be avoided if people could just get on board with the idea of irradiating the meat. We could kill all of that stuff. But people are afraid. People are afraid of radiation. Oh, it's going to damage the food, or blah, blah, blah. No, it doesn't. It doesn't. And what people don't realize, which I think is just hysterical, is pork. Buy pork at the grocery store, it has been irradiated. People just don't realize it, so they don't make a fuss about it. Trichinosis, lockjaw, used to be a significant problem from undercooked pork. So they now irradiate all pork to get rid of trichinosis because it was just such a big health hazard. But there's people out there eating pork that are going to, make a fuss about their strawberries being irradiated. So here's a picture showing these strawberries are the same age. These were irradiated, those were not. These stay fresh and nice much, much longer than those. I mean, ew, disgusting, right? Irradiation does not make the food radioactive. It does not alter its nutritional value. It is very, very beneficial, so please don't be afraid of it. We can also use radioactivity to control populations of harmful insects. One technique is to sterilize fruit flies and release them into the field. And so the sterilized fruit flies are going to mate with the other fruit flies who have no idea that they're mating with a sterile partner, and then they can't make any more babies. So it's like, okay, let's keep all these fruit flies busy mating with sterilized fruit flies, and then we can knock down their population. Any other questions?